We are here for a press conference around the influenza vaccination program that is going on in Baton Rouge. It's the largest program that is in the state of Louisiana. We've done it now this is our 4th year. Every year we immunize about 8,000 children, and our dream and our goal is to actually immunize between 12 and 16,000. So we hope to do that this year.
Well, coincidentally, we started this program about 4 years ago, and during this season, in the flu season, it's important for our children to be healthy and in school, and I think you can correlate to some extent this program starting 4 years ago to the improvement that we've made in our district performance score. In fact, 2 years ago we were in F district. Today we're D district, and I'm not real happy about that. But we've made double-digit growth, and if you go back and longitudinally from 2003 to about the time this program started, the district performance score had improved less than 3%, and since this program has started, it's improved at double digits, somewhere around 13%. And I can assure you, next year we will not be a D district, we will be a C district, and we will continue to improve. So it's important to have children in school that's healthy and that's learning. And if they are not, and we have an outbreak in our schools, then it's going to be devastating when our children take that state assessment test this spring.
Point that kids tend to transmit illnesses quite a bit more. They sneeze, they have snot, they rub their hands, they rub their nose, and they put it on toys, and they transmit it quite more easily than adults do. The vaccine helps prevent the receipt of flu virus itself and helps prevent significant disease in the community.
The goal is to try to, in this parish, to get at least 16,000 children vaccinated. Because not only does it protect them, it also protects the entire community. If you have enough people that are vaccinated, it stops the spread of influenza. Also, what you see with children that don't get the flu, they don't get sick, they don't miss school days, they do better on their test scores. And so it's a win-win situation altogether, and we have a number of partners here. We have Our Lady of the Lake here, we have the school system here. We are helping to provide cold storage for the vaccine. So it's one of the principal things that in government and in the medical professions that we are responsible for, and that's to protect our population, and that's what we're doing here today. This is a very good thing. It's one of the most basic things that we are responsible to do.
Our role is we're taking care of the children who don't qualify for the federal Vaccines for Children program. We're purchasing immunization for those kids. In past years, might have been about a $100,000 investment, but our mission is to improve the health of people throughout our community, and this is an extension of that. We're able to offer this immunization with the hope that as many kids as possible take it, and then we have a lighter flu season this year.
We are holding this press conference about our seasonal flu vaccination program. This is our 4th year of doing this campaign. It is the single most preventive program that we can do for this community, because not only are we protecting children, we are also protecting their baby brothers and sisters and their grandparents. So this impact has huge rollout across the community. We are going to be doing this program so that you understand its magnitude. We will be doing this the entire month of October and the entire month of November, and possibly even come back in December to do some more immunizations. To date, every year, we have done 8,000 immunizations. Our goal is to get to 16,000. So we are very pleased to be here. I can tell you that as of yesterday, we had immunized about 800 kids in about 6 schools. So it is really working, and we really appreciate all of your help with advertising it and helping parents understand just how important it is. But I will also tell you this: we could not do this program alone. And that's why all of our partners are here. It is a very networked program. We use the refrigeration capacity of the Department of Agriculture and Forestry. Our Lady of the Lake Foundation gives us funding so we can purchase vaccine for children who don't qualify for the federal Vaccines for Children program. The Department of Health and Hospitals gives us another source of vaccine. The school system prints all the consent forms, and when I say all of the consent forms, please know I'm talking 45,000 of them. And so the work that we do depends on our partners. And then our staff could not be the single mode of delivery because we just don't have enough staff. So every school of nursing comes to this program and helps us deliver vaccine to children. I want to introduce to you all Ms. Mary Nell Dominique. She is the Assistant Superintendent of Elementary Schools over Area 1, and she will welcome you to the school.
Thank you, Sue. Welcome, community members and the media. We are here today to recognize and to say to the public that student health is a priority for the East Baton Rouge Parish schools. The impact influenza can have on schools, teachers, children, and parents, it's huge. We know that when students are healthy, their families are healthy. Students' attendance is high, and academic performance is accelerated. Early vaccination is the answer. Today, we're proud, we're excited to be here to kick off the school-based influenza vaccination clinic here at LaSalle Elementary. Nature and purpose is to protect East Baton Rouge Parish residents, particularly our children and our families. So today, we encourage all of our children and our families to make sure that you sign the necessary forms to make sure that our children are protected so we can increase the immunization rate throughout this parish. Again, thank you, and we're excited today.
Thanks, Ms. Dominique. Ms. Dominique, I first met her as the principal of Northeast Elementary School, so she has a long history of learning how to operate a school building. The other important thing that we're here today to talk about is we've only released elementary school consent forms. Next week, we will send out all middle and high school forms, and we want those parents to pay particular attention to get those consent forms back to us. So that you understand the magnitude of what we're doing, we have in Baton Rouge, Louisiana right now just about 10,000 doses of flu vaccine. And if we were to bring that into this room, it would occupy fully a quarter of the space of this room. One of our partners makes this absolutely able to be done because he has huge refrigerated warehouses. It is my pleasure to introduce to you Dr. Mike Strang. He is the Commissioner of Agriculture and Forestry.
Thank you. Thank you very, very much. It's very good to be here. One of my favorite subjects is immunization, especially early childhood immunizations. You know, here in this century, we take a lot of things for granted. And one of the things it seems more and more, people don't understand that the flu and these other diseases can be tremendously problematic. But we can conquer that with vaccination. It is absolutely critical and necessary. So many of our children now, live a long life because they are vaccinated. The flu virus is something that we must always be cognizant of. And if you look back historically, there have been tremendous flu epidemics. Totally preventable. It is absolutely critical that we have enough people vaccinated in order not only to protect that individual, but to stop the spread of the disease. So I want to thank you for allowing us to be a partner. And I will tell you, any asset that we have will always be available to you. Thank you.
Our next partner that we would like to introduce is the Superintendent of the East Baton Rouge Parish School System, who's come here, and for 3 years he's had a huge learning curve about health. But I think he's pretty amazed with some of the things that we do, and this is one of the things that sets us apart. We do the largest flu program in the state of Louisiana here in Baton Rouge because of the partners that we have. Mr. Dilworth.
I have been here 2 years now, Sue, going on 3. This is my 3rd year, and I heard Sue mention that this immunization program started 4 years ago. And I thought about the longitudinal data that I've been looking at with the district performance score from 2003 until the scores were released today. The fact is, the most important time of the school year we're approaching now as it pertains to student assessment. The months of October, December, January, and February, if our children are not prepared for state assessments, they're not going to get prepared later on. So it's important that our children are healthy, number one, beyond test scores. These immunizations can prevent the spread of influenza. And just talking about the data, I have to think that the immunizations have had something to do with the increase in the performance of our district performance score. Because from 2003 to about 2008 or 9, we grew less than 3 points as a district performance score. Since then, we've had double-digit growth over the last couple of years. You know the report card just came out, but the fact is 2 years ago, this district was rated an F district, a one-star district. A year ago this time, we received a 2-star rating, which would be a D, which we still are today. But I'm happy to say, because of all the different things, and I think this has a part, the immunization, having children in school that are healthy and learning plays a part in us being 3.8 points away from a C, and we're going to do that. This time next year, we will have a C district. And I have to think it's in part to having healthy kids in school with the immunizations, but health centers in schools, period. I can't tell you how impressed I've been since I've been here with our health centers and schools and the way they provide services for our students and families. So again, thank all of you who are involved. I encourage all parents to sign the permission form for the immunization, and we appreciate everything. Thank you so much.
We could not do this program if we could not offer the vaccine to everyone. And while we have excellent resources from the Department of Health and Hospitals, they do not have all of the vaccine that we need. We must have a way to get vaccine for children who don't qualify for Vaccines for Children, which is a federal program. Every year, Our Lady of the Lake Foundation has stepped up to be that partner, and I'd like to introduce John Paul Funes.
Thank you, Sue. I want to thank Assistant Superintendent Dominique and Superintendent Dilworth for allowing us to do this, and Sue for being the visionary to establish such a program. We obviously couldn't do this without several partners. Dr. Strain and Agriculture and Forestry has been mentioned, but we have two other partners, East Baton Rouge Parish Emergency Medical Services. They're the folks who transport this for us and get it around for us. And if you think what Sue's talking about, doing immunizations over about a 10-week period, there's a lot of logistics involved, so we couldn't do it without them. And then also this year, we've gotten a lot of public relations support through a grant from Every Kid a King Foundation, and that's was started just over 2 years ago by Jim and Dana Bernhardt here in Baton Rouge. And for a foundation that's not quite 2 years old, has done amazing work. So I want to thank those two groups too. The school-based health clinics are the wave of the future, even though we're ahead of the curve right now in Baton Rouge. What we're doing is amazing work, and it's due to Sue's leadership and her team. But the immunization program is something that she modeled off a program in Texas, which endeavors to immunize as many kids as possible with the idea of a herd immunity where the community then becomes immunized as a result. So what we're doing here is with that in mind. Our involvement, as Sue said, is to take care of those children who don't qualify for the federal Vaccines for Children program. And that's really a direct part of our mission to extend our healing ministry. And our sisters, the Franciscan Missionaries Our Lady, came to Louisiana 100 years ago in 1911. And it's particularly, for me, poignant that we're doing this today, because that's exactly what they had in mind, to make sure that we extend that outside of the hospital. So you know where we are. Dr. Bolton's going to tell you a little bit about from the medical perspective, but we've already had a local physician test positive for influenza. So it's here. That was in the first week in October. So influenza's here, and if we don't get a chance to get all these children in the East Baton Rouge school system and beyond immunized, it's only going to be a bigger problem. So we want to stress the fact that it's here already, and we need to take care of it. And again, to the school system, to Dr. Strain, to EMS, to the Bernhardts, and every kid at King Foundation, thank you, because I do believe this is going to be our best effort ever. And the thing that we want to stress is the best way to prevent flu in your family and in our community is for everyone to be immunized. So that's why we're stepping up to make sure we do that. And I think the best year we've had has been what Sue said, in the under 10,000. So we'd like to get as many kids, and we're ready to write the check for it beyond 10,000. So thank y'all very much.
So that you all will remember this, we could not do this without the impact and help from physicians. We had a meeting with all of the pediatricians before we ever did this, because we needed them to be supportive, and they are. But there was another key physician who was involved in this who could not be here today, and he is Congressman Bill Cassidy, who is an infectious disease specialist. Because the lake has been so involved in this, as been so many other people, we've asked them for a physician who has that same kind of expertise. I understand he's new to our community. His name is Dr. Michael Bolton. He is a pediatric infectious disease specialist. Dr. Bolton.
Good morning. I'd like to take this opportunity to thank everybody who invited me here today to discuss flu. Ms. Ketchy, Ms. Dominique, Ms. Stillworth, Mr. John Paul Funes, and Dr. Strain. And it's nice from an infectious disease standpoint to hear everybody else talk about how important the flu vaccine is. It's an illness that for me, I tend to see the worst outcomes of flu by the time a child gets to my office or gets to the hospital where I am seeing them. I'm biased from the standpoint that it's a vaccine preventable illness. And as Dr. Strain mentioned, people forget about how serious infections can be because we have vaccines, whether it be to diphtheria, whether it be to tetanus, or whether it be to Haemophilus influenza. I'm not the oldest person in the room, but I've seen a few cases of severe illnesses when kids don't have immunizations. And so, I think it's important for everybody to remember and to be pressed upon about how important vaccines are and how they prevent severe disease. The lake probably doesn't like me saying that, because the more infections there are, the more business I get. So, but it's important that vaccines are administered at an appropriate time to the appropriate population. This year, the flu vaccine consists of 3 strains of influenza. There are 2 influenza A strains, one of which is the novel H1N1 that we saw a few years ago, and then there's influenza B strain as a third part of the vaccine. It comes in 2 flavors. It has a shot, and then the flu mist as well. The shot is a non-live virus, whereas the flu mist is a attenuated or a weakened virus. And it is recommended by multiple organizations, including the Center for Disease Control and Prevention, the American Academy of Pediatrics, the Infectious Diseases Society of America, that all people 6 months of age and older be vaccinated with the flu vaccine. So it's important, as Jean-Paul mentioned, about herd immunity. So we worry about the kids who are less than 6 months of age who do not have the opportunity to be vaccinated. So it's important for their older siblings, their brothers and sisters, to be vaccinated. It's important for the adults in the household to be vaccinated. And whenever they go to grandparents' house, they need to be vaccinated as well. Studies have shown that the most severe disease of flu is in kids who are less than 2 years of age and adults who are 65 years and older. And the key thing, this is a preventable disease. We see what happens when we don't have a flu vaccine that's effective, as we saw a few years ago when they had the novel H1N1 flu. It's important that we see that when vaccines are given, we have less severe disease, as evidenced last year when we had appropriate strains circulated and an appropriate vaccine to take care of those strains. And so we had a much less severe flu season. This year, the flu vaccine is the same one as it was last year. So the question is, why do we need to get another one this year? Well, it's been shown that the immunity wanes over a year's time. And so that while you were immune last year when you got the vaccine, you still need another dose this year to cover the same strains because your immunity wanes. There are other ways to prevent the flu, but it's been shown that the vaccine is the single most effective way of prevention. Other ways, especially for children and adults, we're not always the most hygienic people. When you cough, cough into your arm, not your hand, because a lot of times your hand goes to other places and your hand gets on books and toys and other people play with that, and the virus can live on outside environments for a while. Make sure you wash your hands thoroughly, and if you are sick with the flu, don't come to work, don't come to school until you are without a fever for at least 24 hours. The best way to prevent that is to get a vaccine. And so it's very nice for me to be the last part of this bandwagon to say that to get your flu vaccine. It's a lot of times I'm on the other side where I'm fighting people to get the vaccine and other people are resisting. So it's nice to hear a consortium that it really cares about the children of the community as well as the rest of the family in the community and Baton Rouge as a whole. So I thank this opportunity for letting me speak. I appreciate it.
Thank you, Doug.
The flu vaccine is one that we are still fighting. We fight every year. A vaccine is the easiest and best way to prevent significant mortality, not only in pediatrics, but also in the community itself.
It is the single most preventive program that we do because while we are protecting the children that we immunize, we are really protecting their baby brothers and sisters and their grandparents because those are the people, if they contract flu, they're the ones who have a hard time throwing it off and could die from it.
Our goal is to keep kids as healthy as possible so they can get an education, and the statistics prove it out. Is if kids are in school, they're learning. If we're taking care of things like immunization, they're not sick, but also their eyesight and all that. So it's important. School-based health is a huge initiative, and we just want to be a partner in making that a reality here in Baton Rouge.
They can call their local school, and the school will be able to assist them and get them a permission form, and the vaccinations are free to families, and I strongly encourage the superintendent's parents to sign the permission form and have their children immunized.
When your child brings home a permission form, please fill it out, and we're going to urge everyone to have your child vaccinated. Did it hurt?
Did it hurt or anything?
It didn't hurt. It just felt like I was about to cry, but I didn't.
If people would like more information, where can they go?
They can call us at our office, 225-343-9505, or they can go to our website, www.healthinschools.org.